The video begins with a white screen. The Mental Health Commission of Canada logo animates on. The video cuts to an empty office with a computer screen on a desk. The logo fades out and black text fades on, reading, "What is Stepped Care 2.0?" The text fades out, and a video image of Carly Straker, Manager of Mental Wellness and Addictions Recovery for the Government of the Northwest Territories, fades on as she speaks.
So when I think of Step Care 2.0, I think of it as this intuitive approach to care.
The video cuts to Mike Harrell, a peer support worker at LifeWise.
I see more choices. I see options. I see the convenience of being able to access care.
Abby Fredericks, Stepped Care Coordinator at Health PEI.
Really be adaptable and responsive to individuals as opposed to just one size fits all.
Lorna Hutt, Director of Community Mental Health and Addictions at Health PEI.
It's an empowering approach in giving people the options that are, most appropriate for them, and it gives them a voice in the decision making and what fits and doesn't fit.
Brad Glynn, Executive Director of LifeWise.
That it really empowers the person receiving care to receive the right care and also improves their mental health literacy so that the informed decision they make is a good one for them.
Carly Straker.
It recognizes all the different components of a person's life and these unique and changing needs and responds to them based on that. It's not this one path. It's not this one approach to care.
Shailene Jones, Executive Director at Eating Disorders Nova Scotia.
How do we transform, how do we improve the mental and physical health of a population? Having supports across the lifespan, across intensity, so that someone may be able to access a lower intensity support pre and post intensive treatment, that's going to help them stay well. So if we only put resources into really high intensity, really expensive treatment, but we're not focusing on maintaining those gains, maintaining those supports, all those other determinants of health, it's harder for folks to maintain those gains they made in recovery if they're not supported.
Mike Harrell.
When you're going through severe mental health and addiction or crisis, having somebody there that can relate and can share with you all the powerful resources that they've used to help them through their journey is priceless. It's truly priceless.
Carly Straker.
When you come in and talk to someone for help, you generally have an idea of what it is you need or want or are up for at that moment in time. But there's also this component of step care where you're able to try different things, and it's okay if something doesn't work, and it's that concept of fail forward, and there's not all this fear around it.
Abby Fredericks.
The system still recognizes the importance of the variety of services and the range of different professionals that work within the system. It just frees up a bit of those wait times and those queues for services, and ensures that services are meeting the needs of people that they're sort of designed to meet, and that everyone is finding that specific service that meets their needs.
Shailene Jones.
If we're able to provide folks with the support or intervention with a staff member or a peer supporter or a workshop or something that's low barrier, low intensity, we can deliver more of those units than we can for unit of therapy. So how do we organize our resources so that we're giving people the best possible support?
Mike Harrell.
We don't have to know it all. We don't have to be the one with all the resources. Let's give people options and choices and flexibility.
Brad Glynn.
We are all a team. We are all doing this together, and therefore I can pass someone where they need to go because that's what's best for the individual, not what's best for me.
Lorna Hutt.
The more we learn about stepped care 2.0, the more we learn about one at a time approach, we really understand that the approach is just that. It's a tool in your toolbox that you can use. It doesn't take away all of that other training and expertise that you have and that you've been using. We still will be using that moving forward. This is just an enhancement of what we're already doing.
Carly Straker.
I think we've removed a little bit of that risk aversion that's been so chronic in our traditional means of support, where we're really fearful of doing the wrong thing or of just different outcomes. And I think this kind of puts the humanness back into it and maintains a connection throughout.
Shailene Jones.
It creates a bit of a shift, and practice change is so hard to do. Culture change is really challenging. So doing that little shift and be like, oh, hey, there's a different way of doing things, and let's look at a different approach. I think this is like a really essential step in moving healthcare forward.
To learn more about Stepped Care 2.0, visit mentalhealthcommission.ca/stepped-care-2-0. The Mental Health Commission of Canada and Stepped Care Solutions logo fade on to the bottom of the screen. The video fades to white and the Mental Health Commission of Canada logo animates on. Blue text fades on reading mentalhealthcommission.ca with social media icons below it. At the bottom of the screen reads Financial Contribution from, with the Health Canada logo below it. A disclaimer reads, the views presented herein solely represent the views of the Mental Health Commission of Canada. Production of this video is made possible through a financial contribution by Health Canada. The video fades to black.